Phlebotomy All Domains Review. Question 1. What type of vessel links the smallest arteriole pathways with the smallest venule pathways? Option A, capillary. Option B, sinusoid. Option C, lymph duct. Option D, deep artery. The correct answer is option A, capillary. Capillaries connect arterioles and venules and provide the main exchange surface between blood and tissues. Their thin walls allow movement of gases, nutrients, and wastes. Arteries and lymph ducts perform different transport functions. Question 2. Which tube is typically utilized to collect samples for blood bank cross-matching and typing? Option A, pink top, EDTA, or plain red top. Option B, light blue top, sodium citrate. Option C, gray top, sodium fluoride. Option D, green top, sodium heparin. The correct answer is option A, pink top, EDTA, or plain red top. Blood bank typing and cross-matching commonly use EDTA pink top tubes or plain red top tubes depending on facility requirements. EDTA preserves red cell antigens and prevents clotting for many immunohematology procedures. Citrate, fluoride, and heparin tubes are used for other testing categories. Question 3. Which of the following tubes contains an additive that prevents clotting by activating antithrombins? Option A, light blue top, sodium citrate. Option B, green top, heparin. Option C, lavender top, EDTA. Option D, gray top, potassium oxalate. The correct answer is option B, green top, heparin. Heparin prevents clotting by activating antithrombin, which inhibits thrombin and other clotting factors. Green top tubes use this mechanism for plasma chemistry and selected special tests. EDTA and citrate work by binding calcium rather than activating antithrombin. Question 4. Which of the following parameters must be strictly managed when collecting a sweat chloride test? Option A, keeping the sample frozen using dry ice. Option B, preventing evaporation of the sweat sample during collection. Option C, protecting the collecting flask from ambient artificial lights. Option D, drawing a matching light blue tube within 5 minutes. The correct answer is option B, preventing evaporation of the sweat sample during collection. Sweat chloride specimens must be protected from evaporation because chloride concentration can change as water is lost. Proper sealing and timely handling preserve the true concentration. Freezing, light protection, or paired coagulation tubes are not the main handling concern. Question 5. Which of the following statements matches the correct definition of assault? Option A, unjustified or unconsented physical contact with another person. Option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Option C, revealing confidential medical findings to unauthorized personnel. Option D, mislabeling a laboratory specimen tube by accident. The correct answer is option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Assault is an intentional threat or attempt that makes a patient fear harmful contact. No physical touching is required for assault to occur. Battery involves unauthorized touching, and confidentiality breaches involve private information rather than threatened harm. Question 6. What does the term erythema mean? Option A, redness of the skin caused by congestion or inflammation of the capillaries. Option B, a pale appearance of the skin due to low red cell counts. Option C, a bluish tint to the skin caused by a lack of oxygen. Option D, a yellowing of the skin caused by high bilirubin levels. The correct answer is option A, redness of the skin caused by congestion or inflammation of the capillaries. Erythema means redness of the skin from capillary congestion or inflammation. It may be seen with irritation, infection, allergy, or localized trauma. Pallor, cyanosis, and jaundice describe pale, blue, and yellow color changes. Question 7. What is the standard depth of a lancet puncture used for a fingerstick on an adult patient? Option A, 1.0 to 1.5 mm. Option B, 1.8 to 2.4 mm. Option C, 3.0 to 4.0 mm. Option D, 4.5 to 5.0 mm. The correct answer is option B, 1.8 to 2.4 mm. Adult fingerstick lancets generally penetrate about 1.8 to 2.4 millimeters. This depth reaches the capillary bed while limiting injury to deeper structures. Shallower punctures may not provide adequate flow, and deeper punctures can cause unnecessary trauma. Question 8. What type of specimen is required for a plasma hemoglobin test? Option A, serum separator tube, SST. Option B, plain red top tube. Option C, heparinized or EDTA plasma free of hemolysis. Option D, whole blood collected in a gray top tube. The correct answer is option C, heparinized or EDTA plasma free of hemolysis. Plasma hemoglobin testing requires plasma that is not contaminated by hemolysis from collection trauma. Heparinized or EDTA plasma is used because anticoagulated blood can be centrifuged to separate plasma. Serum or visibly hemolyzed specimens can falsely affect the measurement. Question 9. What is the appropriate antiseptic choice for blood culture site preparation in patients older than 2 months? Option A, 70% isopropyl alcohol alone. Option B, chlorhexidine gluconate or tincture of iodine. Option C, sterile saline solution. Option D, benzalkonium chloride. The correct answer is option B, chlorhexidine gluconate or tincture of iodine. Blood culture site preparation must strongly reduce skin flora to prevent false positive cultures. Chlorhexidine gluconate or tincture of iodine is commonly used for patients older than 2 months, depending on policy. Alcohol alone is not sufficient for many culture protocols, and saline is not an antiseptic. Question 10. Which of the following actions is a violation of proper sharp disposal safety guidelines? Option A, dropping a needle into the sharps box immediately after withdrawal. Option B, pushing down on items inside a full sharps container to make extra room. Option C, disposing of a sharps box when it reaches the indicated full fill line. Option D, placing the sharps container at eye level near the point of use. The correct answer is option B, pushing down on items inside a full sharps container to make extra room. Pressing down on a full sharps container can cause puncture injury and aerosol exposure. Sharps containers should be replaced when they reach the marked fill line. They should be located near the point of use and never overfilled or manually compacted. Question 11. Which of the following scenarios describes the correct patient preparation for an oral glucose tolerance test, OGTT? Option A, the patient should eat a low-carbohydrate diet for 3 days prior to the test. Option B, the patient must fast for at least 8 to 12 hours before the baseline draw is performed. Option C, the patient should exercise vigorously right before drinking the glucose solution. Option D, the patient can drink black coffee or tea during the hours of the testing period. The correct answer is option B. The patient must fast for at least 8 to 12 hours before the baseline draw is performed. An OGTT begins with a fasting baseline specimen, usually after 8 to 12 hours without caloric intake. Food, coffee, or strenuous exercise can alter glucose metabolism and invalidate the test. A low-carbohydrate diet before testing can also distort the response to the glucose load. Question 12. What type of consent is required before a phlebotomist can draw blood from a minor child? Option A, implied consent from the child's teacher. Option B, informed or expressed consent from a parent or legally authorized guardian. Option C, no consent is needed as long as a doctor ordered the test. Option D, verbal consent from the minor patient themselves. The correct answer is option B, informed or expressed consent from a parent or legally authorized guardian. A minor generally requires consent from a parent or legally authorized guardian before routine blood collection. The child should still receive age-appropriate explanation and cooperation should be sought when possible. A physician order alone does not eliminate consent requirements. Question 13. What is the correct action if a phlebotomist accidentally sticks themselves with a used needle? Option A, wash the site with soap and water and immediately report the incident to a supervisor. Option B, squeeze the wound to expel blood and apply a tight bandage. Option C, wait until the end of the shift to fill out an incident report. Option D, ask the patient if they have any blood-borne infectious diseases. The correct answer is option A, Wash the site with soap and water and immediately report the incident to a supervisor. A needle stick exposure should be washed promptly with soap and water and reported immediately. Rapid reporting allows exposure evaluation, source testing when permitted, and timely post-exposure management. Squeezing the wound, delaying the report, or questioning the patient informally is not an adequate response. Question 14. Which of the following parameters can cause a false elevation in a patient's white blood cell count? Option A. Collecting the sample while the patient is crying intensely or under extreme stress. Option B. Chilling the specimen on an ice slurry before transport. Option C. Protecting the collection tube from direct artificial room lights. Option D. Allowing the serum to sit on the cells for more than 2 hours. The correct answer is option A. Collecting the sample while the patient is crying intensely or under extreme stress. Extreme stress, crying, or intense physical exertion can temporarily elevate the white blood cell count. Stress hormones can shift leukocytes into circulation and make the value appear higher. Specimen chilling or light protection does not produce this physiologic leukocytosis. Question 15. What is the proper angle of insertion when using a winged infusion set, butterfly needle, to draw from a hand vein? Option A. 5 to 10 degrees. Option B. 10 to 15 degrees. Option C. 30 to 45 degrees. Option D. 60 to 90 degrees. The correct answer is option B. 10 to 15 degrees. A butterfly needle is inserted at a lower angle, often about 10 to 15 degrees, especially for superficial hand veins. The shallow angle helps enter small veins without puncturing through them. Steeper angles are more likely to cause infiltration or injury in hand veins. Question 16. What should a phlebotomist do if an inpatient's door is closed and a sign states "No visitors, see nurse" before entering? Option A. Knock loudly, open the door, and walk right in to maintain efficiency. Option B. Locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Option C. Skip the patient and come back at the end of the shift without checking in. Option D. Call the patient's room phone from the hallway to ask if it is okay to enter. The correct answer is option B. Locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Assign directing staff to see the nurse may indicate isolation, safety, behavioral, or procedure restrictions. The phlebotomist should check with the assigned nurse before entering. Entering without clarification can endanger the patient, staff, or specimen collection process. Question 17. What is the clinical term for a state of fainting or temporary loss of consciousness caused by a sudden drop in blood pressure? Option A. Syncope. Option B. Shock. Option C. Vertigo. Option D. Hemastasis. The correct answer is option A. Syncope. Syncope is a temporary loss of consciousness caused by reduced blood flow to the brain, often from a sudden blood pressure drop. It may occur during venipuncture due to anxiety, pain, fasting, or vasovagal response. Shock and vertigo are different clinical conditions. Question 18. Which of the following situations requires a phlebotomist to follow airborne precaution protocols? Option A. Collecting blood from a patient with a suspected MRSA skin infection. Option B. Drawing samples from a patient diagnosed with measles or active varicella. Option C. Performing venipuncture on a patient with seasonal rhinovirus. Option D. Collecting a lipid panel from a patient with hepatitis C. The correct answer is option B. Drawing samples from a patient diagnosed with measles or active varicella. Measles and active varicella spread by airborne particles and require airborne precautions. This includes an appropriate respirator and a negative pressure room when available. MRSA skin infections usually require contact precautions, and hepatitis C follows blood-borne standard precautions. Question 19. Which of the following conditions is characterized by a dangerous drop in blood volume, causing pale skin, rapid pulse, and hyperventilation? Option A. Hypovolemic shock. Option B. Septic shock. Option C. Anaphylactic shock. Option D. Cardiogenic shock. The correct answer is option A. Hypovolemic shock. Hypovolemic shock results from dangerously reduced circulating blood volume. Signs may include pale cool skin, rapid pulse, low blood pressure, anxiety, and hyperventilation. Septic, anaphylactic, and cardiogenic shock arise from different mechanisms. Question 20. Which of the following tubes contains an additive that preserves glucose levels for up to 3 days? Option A, gray top, sodium fluoride. Option B, light blue top. Option C, lavender top. Option D, green top. The correct answer is option A, gray top, sodium fluoride. Gray tubes containing sodium fluoride preserve glucose by inhibiting glycolysis for an extended period. This helps maintain glucose concentration when processing may be delayed. Other tube types do not provide the same glucose stabilizing additive. Question 21. Which of the following errors is an example of a post-analytical error? Option A, failing to mix an EDTA tube, causing a microclot to form. Option B, mislabeling a patient's name at the bedside drawer. Option C, delayed reporting of critical panic values to the attending physician. Option D, leaving a tourniquet on a patient's arm for 3 minutes. The correct answer is option C, delayed reporting of critical panic values to the attending physician. Delayed reporting of a critical value occurs after analysis, so it is a post-analytical error. Timely communication of panic values is essential because treatment may depend on rapid notification. Collection, labeling, and tube mixing errors occur before analysis. Question 22. What type of legal charge can be filed if a phlebotomist discloses a patient's private medical details to a neighbor? Option A, assault. Option B, battery. Option C, invasion of privacy or breach of confidentiality. Option D, negligence. The correct answer is option C, invasion of privacy or breach of confidentiality. Sharing a patient's private medical details with a neighbor is a breach of confidentiality and invasion of privacy. Health information may be disclosed only for authorized treatment, payment, operations, or with proper permission. Assault and battery involve threats or touching rather than privacy violations. Question 23. What is the clinical term for blood that has escaped from a vessel into the surrounding tissue layers? Option A, petechiae. Option B, hematoma. Option C, thrombus. Option D, hemostasis. The correct answer is option B, hematoma. A hematoma is blood that has leaked from a vessel into surrounding tissue. It may appear as swelling, bruising, or tenderness at the puncture site. Petechiae are pinpoint hemorrhages, while a thrombus is a clot inside a vessel. Question 24. What type of cleaning solution should be used to disinfect a phlebotomy tray on a daily basis? Option A, concentrated isopropyl alcohol. Option B, a 1:10 dilution of household bleach or an EPA-approved hospital disinfectant. Option C, warm water mixed with mineral oil. Option D, liquid hand soap solution. The correct answer is option B, a 1:10 dilution of household bleach or an EPA-approved hospital disinfectant. Phlebotomy trays should be disinfected with a bleach dilution or EPA-approved hospital disinfectant. Daily and visible soil cleaning reduces transfer of bloodborne pathogens and environmental organisms. Water, mineral oil, or hand soap alone does not provide adequate surface disinfection. Question 25. Which of the following veins is located on the medial, inner, aspect of the antecubital fossa and is close to the brachial artery? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, radial vein. The correct answer is option B, basilic vein. The basilic vein is located medially on the inner side of the antecubital area. It lies closer to the brachial artery and median nerve than the preferred veins. This anatomical relationship is why it is usually avoided unless necessary. Question 26. Which of the following options defines the proper site for an adult capillary puncture? Option A, the thumb or index finger of the dominant hand. Option B, the lateral or medial plantar surface of the heel. Option C, the palmar surface of the distal segment of the middle or ring finger. Option D, the side of the pinky finger near the cuticle. The correct answer is option C, the palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 27. Which of the following additives is used to preserve glucose stability by preventing its breakdown by red blood cells? Option A, sodium citrate. Option B, sodium fluoride. Option C, lithium heparin. Option D, ammonium oxalate. The correct answer is option B, sodium fluoride. Sodium fluoride preserves glucose by inhibiting glycolysis in blood cells. This slows cellular consumption of glucose after collection. Citrate, heparin, and oxalate alone do not provide the same glycolysis inhibition. Question 28. What type of consent is given when a patient extends their arm and rolls up their sleeve for a blood draw? Option A, informed consent. Option B, expressed consent. Option C, implied consent. Option D, statutory consent. The correct answer is option C, implied consent. Implied consent occurs when a patient cooperates through behavior rather than signing or verbally stating agreement. Extending the arm after the procedure is explained shows permission for a routine blood draw. Written informed consent is used for procedures with greater risk or more formal requirements. Question 29. What is the main clinical outcome of inadvertent arterial puncture during a venipuncture attempt? Option A, rapid hematoma formation and bright red pulsing blood. Option B, falsely decreased systemic blood pressure. Option C, accelerated hemolysis within the vacuum collection tube. Option D, immediate collapse of the surrounding capillary beds. The correct answer is option A, rapid hematoma formation and bright red pulsing blood. Accidental arterial puncture often produces bright red, pulsating blood and can cause rapid hematoma formation. The needle should be removed and firm pressure applied because arterial pressure is higher than venous pressure. Treating it like a routine venous draw increases bleeding risk. Question 30. What should the phlebotomist do immediately before applying a bandage to a venipuncture site? Option A, check the site to confirm that active bleeding has completely stopped. Option B, ask the patient to bend their elbow firmly over the gauze pad. Option C, apply a generous layer of antibiotic ointment to the wound. Option D, label the tubes using the patient's bedside charts. The correct answer is option A, check the site to confirm that active bleeding has completely stopped. The puncture site must be checked to confirm bleeding has stopped before a bandage is applied. Bandaging over active bleeding can hide continued blood loss and increase bruising. Bending the elbow can also promote hematoma formation and should not be used as pressure technique. Question 31. If a phlebotomist encounters an outpatient who is hyperventilating and trembling with severe anxiety before a draw, what should they do? Option A, proceed immediately to get the draw over with quickly. Option B, instruct the patient to take slow, deep breaths and offer reassurance. Option C, reschedule the test for a different week. Option D, administer a sedative if available in the room. The correct answer is option B, instruct the patient to take slow, deep breaths and offer reassurance. Severe anxiety and hyperventilation should be addressed before attempting venipuncture. Calm reassurance and slow breathing can reduce the risk of syncope, movement, or panic during the draw. Proceeding quickly or administering medication is not appropriate for a phlebotomist. Question 32. What tube additive prevents clotting by binding or chelating calcium? Option A, lithium heparin. Option B, DDTA. Option C, sodium polyethylene sulfonate. Option D, thrombin. The correct answer is option B, EDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 33. Which of the following is a primary duty of a phlebotomist regarding quality assurance? Option A, interpreting abnormal lab results for patients. Option B, ensuring specimen tubes are collected, labeled, and transported correctly. Option C, changing medication doses based on therapeutic levels. Option D, performing complex tissue biopsies in the operating room. The correct answer is option B, ensuring specimen tubes are collected, labeled, and transported correctly. Phlebotomy quality assurance focuses on collecting, labeling, handling, and transporting specimens properly. These pre-analytical steps have a major impact on result accuracy. Interpreting results, changing medication doses, or performing biopsies is outside the phlebotomist's usual role. Question 34. What is the primary medical reason for avoiding dermal punctures on the heel of an infant who has begun walking? Option A, the skin has developed calluses that block capillary action flow. Option B, the child's heel bone is too small to locate accurately. Option C, walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Option D, walking diverts all white blood cells up toward the abdominal cavity. The correct answer is option C, walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Once an infant begins walking, heel tissue becomes thicker and more calloused and is more vulnerable to deep tissue irritation. Heel puncture at that stage can be painful and less reliable for capillary sampling. Finger puncture or another approved method is used according to age and policy. Question 35. Which of the following parameters can cause a false decrease in bilirubin levels if a sample is handled improperly? Option A, over-isotonic chilling. Option B, exposure to direct room light or sunlight. Option C, inverting the tube more than 10 times. Option D, delays in serum separation beyond 4 hours. The correct answer is option B, exposure to direct room light or sunlight. Light exposure breaks down bilirubin and can produce falsely decreased results. Specimens for bilirubin testing should be protected from strong light soon after collection. Chilling, inversion count, or routine separation delays do not cause the same light-driven degradation. Question 36. What type of fluid is obtained during a lumbar puncture procedure? Option A, pleural fluid. Option B, synovial fluid. Option C, cerebrospinal fluid, CSF. Option D, peritoneal fluid. The correct answer is option C, cerebrospinal fluid, CSF. A lumbar puncture obtains cerebrospinal fluid from the subarachnoid space. CSF surrounds the brain and spinal cord and is tested for infection, bleeding, malignancy, and other neurologic conditions. Pleural, synovial, and peritoneal fluids come from different body cavities. Question 37. What type of specimen is generated when a blood sample collected in a plain red top tube is allowed to clot and then centrifuged? Option A, plasma. Option B, serum. Option C, whole blood. Option D, fibrinogen-rich extract. The correct answer is option B, serum. Serum is produced when blood is allowed to clot and the clotted specimen is centrifuged. It is the liquid portion remaining after fibrinogen and clotting factors are consumed in clot formation. Plasma requires an anticoagulant and still contains clotting factors. Question 38. Which of the following factors can cause a false decrease in a patient's serum glucose measurement? Option A, separating the serum from the red blood cells within 30 minutes of collection. Option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Option C, transporting the specimen to the laboratory on an ice slurry. Option D, utilizing a gray top tube containing sodium fluoride to collect the sample. The correct answer is option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Glucose can fall falsely when an uncentrifuged specimen sits at room temperature because cells continue to metabolize glucose. This ongoing glycolysis lowers the measured concentration over time. Prompt separation or collection in a fluoride-containing tube helps prevent the decrease. Question 39. What color top tube contains the additive sodium citrate and is used for coagulation profiles? Option A, light blue top. Option B, lavender top. Option C, green top. Option D, gray top. The correct answer is option A, light blue top. Light blue tubes contain sodium citrate and are used for coagulation profiles. Citrate binds calcium reversibly and preserves clotting factors for testing when the tube is properly filled. Other tube colors contain additives that can interfere with coagulation assays. Question 40. Which of the following elements must be matched precisely between a patient's requisition sheet and their wristband? Option A. Patient's first name, last name, and unique medical record number. Option B. Patient's room number and name of their primary insurance carrier. Option C. Name of the ordering physician and the date the patient was admitted. Option D. Patient's diagnosis code and home phone number. The correct answer is option A. Patient's first name, last name, and unique medical record number. The requisition and wristband must match the patient's name and unique medical record number or equivalent identifier. Matching these identifiers confirms that the order belongs to the patient being drawn. Insurance, diagnosis, and physician information do not establish patient identity at the bedside. Question 41. Which of the following is the correct order of draw for a dermal, capillary, puncture? Option A. Lavender, green, red. Option B. Red, green, lavender. Option C. Green, lavender, red. Option D. Light blue, lavender, green. The correct answer is option A. Lavender, green, red. Capillary collections prioritize EDTA specimens first because small skin puncture samples clot rapidly. Other additive tubes follow, and serum tubes are typically collected last because clotting is expected there. Using venipuncture order for capillary specimens can allow microclots to compromise hematology testing. Question 42. A patient under contact precautions requires a blood draw. Which of the following personal protective equipment, PPE, must the phlebotomist don before entering the room? Option A. N95 respirator and gloves. Option B. Gown and gloves. Option C. Surgical mask and face shield. Option D. Gown, mask, and goggles. The correct answer is option B. Gown and gloves. Contact precautions require barrier protection against organisms spread by direct touch or contaminated surfaces. Gown and gloves protect clothing and hands before entering the room and should be removed according to facility procedure before exit. Respirators are reserved for airborne hazards, while masks and eye protection are added when splash or droplet exposure is expected. Question 43. Which of the following additives is found in a green top tube and works by inhibiting the action of thrombin in the clotting process? Option A. Sodium citrate. Option B. EDTA. Option C. Heparin, lithium, ammonium, or sodium. Option D. Potassium oxalate. The correct answer is option C. Heparin, lithium, ammonium, or sodium. Green top tubes contain heparin, which prevents clotting by enhancing antithrombin activity and inhibiting thrombin. Lithium, sodium, and ammonium heparin are selected based on test requirements. Citrate, EDTA, and oxalate prevent clotting by binding or precipitating calcium. Question 44. What color top tube contains the additive EDTA and is used for molecular diagnostic testing and viral load checks? Option A. Pearl/white top with gel barrier. Option B. Light blue top. Option C. Gray top. Option D. Yellow top with SPS. The correct answer is option A. Pearl/white top with gel barrier. Pearl or white top tubes commonly contain EDTA with a gel barrier for molecular diagnostic tests such as viral load testing. EDTA helps preserve nucleic acid stability and prevents clotting. Light blue, gray, and yellow SPS tubes serve coagulation, glucose, or culture-related purposes. Question 45. What should a phlebotomist do if a patient experiences a sudden, sharp, shooting pain down their arm during a venipuncture? Option A. Advance the needle deeper to see if the pain stops. Option B. Terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Option C. Tell the patient that minor discomfort is completely normal for this vein. Option D. Instruct the patient to keep their arm completely still while you finish filling the tube. The correct answer is option B. Terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Sudden sharp shooting pain down the arm suggests possible nerve contact. The venipuncture should be terminated immediately, the needle withdrawn, and the patient assessed according to policy. Continuing or redirecting the needle can worsen nerve injury. Question 46. What is the correct order of draw for a capillary puncture when collecting multiple microcollection tubes? Option A, serum tubes, heparin tubes, EDTA tubes. Option B, EDTA tubes, other additive tubes, serum tubes. Option C, heparin tubes, EDTA tubes, serum tubes. Option D, serum tubes, EDTA tubes, heparin tubes. The correct answer is option B, EDTA tubes, other additive tubes, serum tubes. Capillary order of draw places EDTA specimens first, followed by other additive tubes and then serum tubes. This order helps prevent microclot formation in small volume hematology specimens. Venipuncture order cannot simply be applied to skin puncture collections. Question 47. Which department of the laboratory processes a comprehensive metabolic panel, CMP? Option A, hematology. Option B, microbiology. Option C, clinical chemistry. Option D, blood bank. The correct answer is option C, clinical chemistry. A comprehensive metabolic panel measures chemistry analytes such as electrolytes, glucose, kidney markers, proteins, and liver-associated enzymes. These tests are processed in clinical chemistry, hematology, microbiology, and blood bank perform different categories of testing. Question 48. What is the clinical purpose of performing a bleeding time test? Option A, to evaluate the integrity of the intrinsic coagulation pathway. Option B, to assess platelet function and the capillary bed's ability to form a primary plug. Option C, to measure the absolute concentration of fibrinogen molecules in plasma. Option D, to screen the body for active systemic bacterial infections. The correct answer is option B, to assess platelet function and the capillary bed's ability to form a primary plug. Bleeding time assesses platelet function and the ability of small vessels to form a primary hemostatic plug. It reflects platelet-vessel interaction rather than the intrinsic or extrinsic coagulation pathways. Coagulation factor problems are better evaluated with tests such as patient or APTT. Question 49. What is the clinical term for a decrease in the total number of circulating red blood cells or a decrease in hemoglobin concentration? Option A, polycythemia. Option B, anemia. Option C, leukemia. Option D, leukoplakia. The correct answer is option B, anemia. Anemia means a decrease in circulating red blood cells, hemoglobin concentration, or oxygen carrying capacity. It can cause fatigue, pallor, shortness of breath, or dizziness depending on severity. Polycythemia is increased red cell mass, while leukoplakia involves white cells. Question 50. What is the primary clinical reason for wiping away the first drop of blood during a capillary skin puncture? Option A, to eliminate surface bacterial contamination from the skin. Option B, to remove tissue fluid contamination that can dilute the sample and cause microclots. Option C, to prevent the blood from clotting too quickly in the microcollection tube. Option D, to ensure that the blood flow is adequate for collection. The correct answer is option B, to remove tissue fluid contamination that can dilute the sample and cause microclots. The first drop from a capillary puncture is wiped away because it can contain tissue fluid and activated clotting material. Removing it improves sample concentration and reduces microclot risk. Excessive squeezing after the puncture can reintroduce tissue fluid contamination. Question 51. What is the primary reason for avoiding venipuncture on an arm with an active hematoma? Option A, the needle will cause the hematoma to spread to the opposite arm. Option B, the sample will be contaminated with hemolyzed, stagnant blood from outside the vein. Option C, the vacuum tubes will implode due to tissue density variations. Option D, it will cause immediate and permanent paralysis of the limb. The correct answer is option B, the sample will be contaminated with hemolyzed, stagnant blood from outside the vein. A hematoma contains pooled blood outside the vein that may be stagnant or hemolyzed. Drawing through or near it can contaminate the sample and worsen tissue injury. A different site, preferably the opposite arm, should be selected when possible. Question 52. Which of the following conditions can cause a specimen's serum to appear bright red or pink after centrifugation? Option A, lipemia. Option B, icterus. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option C, hemolysis. Hemolysis releases hemoglobin from red cells and gives serum or plasma a red to pink color after centrifugation. It can also falsely alter potassium, LDH, ASD, and other analytes. Lipemia appears milky, and icterus appears yellow to amber. Question 53. What does the term lipemia describe? Option A high concentration of broken red blood cells giving serum a red tint. Option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Option C, a dark yellow or amber tint in serum caused by elevated bilirubin levels. Option D, a clear, watery fluid component lacking any cellular proteins. The correct answer is option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Lipemia describes a cloudy or milky serum or plasma appearance caused by high lipid content. It commonly follows recent fatty meals or certain metabolic conditions. Hemolysis appears red or pink, while icterus appears yellow to amber. Question 54. What should a phlebotomist do if they note that a light blue top tube did not fill completely due to a loss of vacuum during a draw? Option A, use the partial sample anyway and send it to the lab. Option B, discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. Option C, pour blood from a green top tube into the light blue tube to top it off. Option D, shake the tube vigorously to force the remaining air out. The correct answer is option B, discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. An underfilled light blue tube must be discarded and recollected because the 9:1 blood to citrate ratio is no longer valid. Sending the partial tube may produce falsely prolonged coagulation results. Transferring blood between tubes or shaking the tube cannot restore the required ratio. Question 55. What is the correct action if a phlebotomist cannot find a suitable vein in either of the patient's antecubital fossae? Option A, probe blindly in the area where the median cubital vein should be located. Option B, inspect the dorsal aspects of the patient's hands for accessible veins. Option C, attempt a venipuncture on the inside aspect of the patient's wrist. Option D, draw blood from a vein located on the anterior aspect of the lower leg. The correct answer is option B. Inspect the dorsal aspects of the patient's hands for accessible veins. If antecubital veins are not suitable, the dorsal hand veins are the usual next site to inspect. They require careful anchoring and often a smaller device because they are more fragile. Blind probing or using wrist and lower extremity sites increases risk and may require special approval. Question 56. What is the proper clinical intervention if a hematoma forms rapidly under the skin while you are drawing a patient's blood? Option A, press down hard on the needle to flatten out the swelling. Option B, release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Option C, switch to a larger vacuum tube to pull the pooled blood out of the tissue. Option D, continue the draw until all ordered tubes are filled completely. The correct answer is option B. Release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Rapid hematoma formation means blood is escaping into tissue during the draw. The tourniquet should be released, the needle removed, and firm pressure applied to stop the bleeding. Continuing the collection or trying to drain the swelling through the tube can worsen injury. Question 57. What color top tube contains sodium heparin or lithium heparin and is the primary choice for stat chemistry determinations? Option A, green top. Option B, light blue top. Option C, lavender top. Option D, yellow top. The correct answer is option A, green top. Green top tubes contain sodium or lithium heparin and are commonly used for stat chemistry testing. Heparin allows plasma to be separated quickly without waiting for clot formation. Serum tubes require clotting time and are not always ideal for urgent chemistry turnaround. Question 58. What is the function of platelets, thrombocytes, in the human body? Option A, transporting carbon dioxide back to the pulmonary system. Option B, producing specific antibody proteins to neutralize viral particles. Option C, participating in primary hemostasis by aggregating to form a platelet plug. Option D, maintaining systemic core body temperature variations. The correct answer is option C, participating in primary hemostasis by aggregating to form a platelet plug. Platelets support primary hemostasis by adhering to damaged vessel surfaces and aggregating into a platelet plug. They also provide a surface for coagulation reactions that stabilize clot formation. Red cells carry gases, and leukocytes provide immune defense. Question 59. What color tube top indicates that the tube contains the additive sodium heparin? Option A, light blue. Option B, dark green. Option C, lavender. Option D, light green. The correct answer is option B, dark green. Dark green tubes indicate sodium heparin in many tube systems. Sodium heparin prevents clotting by interfering with thrombin activity and is used for selected chemistry or special testing. Light green usually contains lithium heparin with gel, while lavender and light blue contain different anticoagulants. Question 60. What type of consent occurs when a patient is fully informed of the risks, benefits, and alternatives of a procedure and signs a document? Option A, informed consent. Option B, implied consent. Option C, verbal consent. Option D, statutory consent. The correct answer is option A, informed consent. Informed consent occurs when a patient understands the procedure, risks, benefits, and alternatives and documents agreement. It is more formal than routine implied cooperation. Verbal or implied consent may be enough for many routine draws, but signed informed consent is used when required by policy. Question 61. If a phlebotomist notes that a patient has an active hematoma in the right antecubital area, where should they draw blood? Option A, distal to, below, the hematoma in the right arm, or use the left arm. Option B, directly through the center of the active hematoma swelling. Option C, proximal to, above, the hematoma on the upper right arm. Option D, from the foot on the same side as the hematoma. The correct answer is option A, distal to, below, the hematoma in the right arm, or use the left arm. An active hematoma contains pooled blood outside the vessel and should not be punctured. The opposite arm is preferred, or a site distal to the hematoma may be used if appropriate and permitted. Drawing through the swelling can contaminate the sample and worsen bruising. Question 62. What is the function of the systemic circulatory system? Option A, moving blood exclusively between the heart and the lungs for gas exchange. Option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C, filtering liquid waste products through the nephron beds of the kidneys. Option D, producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 63. Which of the following elements can cause a falsely elevated calcium level during a venipuncture? Option A, prolonged tourniquet application past 2 minutes. Option B, chilling the specimen on an ice slurry. Option C, using a 21-gauge needle on a large vein. Option D, failing to wipe away the first drop of blood during a finger stick. The correct answer is option A, prolonged tourniquet application past 2 minutes. Prolonged tourniquet application can concentrate proteins and protein-bound analytes, including calcium. This may create falsely elevated calcium results. Chilling, normal needle size, or capillary first drop handling do not cause the same venous stasis effect. Question 64. What type of safety equipment should be accessed if a hazardous chemical splashes directly onto a phlebotomist's arms and torso? Option A standard eye wash station. Option B, a safety drench shower. Option C, a fire blanket wrap. Option D, an isolation gown station. The correct answer is option B, a safety drench shower. A safety drench shower is used when hazardous chemicals splash over large body areas such as the arms and torso. Immediate flushing helps dilute and remove the chemical to reduce tissue damage. An eye wash station is designed for eye exposure rather than full body contamination. Question 65. Which of the following parameters can cause a false decrease in glycolysis tracking within a serum specimen? Option A, leaving the serum in contact with the red blood cells for longer than 2 hours. Option B, chilling the specimen on ice immediately after collection. Option C, protecting the specimen from exposure to room lights. Option D, mixing the tube gently 5 times right after the draw. The correct answer is option A, leaving the serum in contact with the red blood cells for longer than 2 hours. Glucose decreases when unseparated blood remains at room temperature because cells continue glycolysis. Serum left in contact with red cells for more than 2 hours can therefore show falsely low glucose. Prompt separation or use of a glycolysis inhibitor helps preserve the result. Question 66. Which of the following additives is found in a grey top tube and works by precipitating calcium to prevent clotting? Option A, potassium oxalate. Option B, sodium citrate. Option C, lithium heparin. Option D, DDTA. The correct answer is option A, potassium oxalate. Potassium oxalate prevents clotting by precipitating calcium, making calcium unavailable for the coagulation cascade. It is commonly paired with sodium fluoride in grey tubes. Citrate and EDTA bind calcium differently, while heparin works through antithrombin. Question 67. Which of the following tubes should be collected first when performing a venipuncture draw using a multisample needle? Option A, light blue top, sodium citrate. Option B, blood culture bottles or yellow SPS tube. Option C, red top, serum. Option D, green top, heparin. The correct answer is option B, blood culture bottles or yellow SPS tube. Blood culture bottles or yellow SPS tubes are collected first in a multisample draw. This protects the culture from additive carryover and supports sterile organism recovery. Coagulation and other additive tubes follow in the established order of draw. Question 68. What is the clinical term for an increase in the total number of circulating red blood cells? Option A, anemia. Option B, polycythemia. Option C, leukemia. Option D, thrombocytopenia. The correct answer is option B, polycythemia. Polycythemia means an increased total number of circulating red blood cells or increased red cell mass. It can thicken blood and increase thrombotic risk depending on cause. Anemia is decreased red cell or hemoglobin concentration. Question 69. What represents the correct order for removing personal protective equipment, PPE, after a procedure? Option A, gown, gloves, mask, goggles. Option B, gloves, goggles, gown, mask. Option C, mask, gown, goggles, gloves. Option D, goggles, mask, gloves, gown. The correct answer is option B, gloves, goggles, gown, mask. PPE is removed in a sequence that limits contamination of clean skin and clothing. Gloves are usually removed first because they are most contaminated, followed by eye protection, gown, and mask according to facility procedure. Removing the mask too early or touching the outside of contaminated PPE increases exposure risk. Question 70. Which of the following procedures describes the correct method for transporting an ammonia specimen to the laboratory? Option A, keep the tube warm inside an incubator at 37 degrees Celsius. Option B, place the tube immediately into an ice and water slurry to chill it completely. Option C, wrap the tube tightly in heavy foil to prevent any exposure to room lights. Option D, maintain the tube at a room temperature of exactly 25 degrees Celsius. The correct answer is option B. Place the tube immediately into an ice and water slurry to chill it completely. Ammonia specimens must be chilled promptly in an ice and water slurry and transported quickly. Delayed or warm handling can allow ammonia levels to rise in the specimen. Light protection and warm incubation are used for different tests. Question 71. Which of the following additives is present in a light green top plasma separator tube, PSD? Option A, sodium heparin and a gel barrier. Option B, lithium heparin and a gel barrier. Option C, DDTA and a gel barrier. Option D, clot activator and a gel barrier. The correct answer is option B, lithium heparin and a gel barrier. Light green PSD tubes contain lithium heparin and a gel barrier. Lithium heparin prevents clotting, and the gel separates plasma from cells during centrifugation. SST tubes contain clot activator for serum rather than heparinized plasma. Question 72. Which of the following tubes contains an additive that preserves cellular morphology for a differential blood smear? Option of light blue top. Option B, lavender top, EDTA. Option C, gray top. Option D, green top. The correct answer is option B, lavender top, EDTA. Lavender EDTA tubes preserve cellular morphology for differential counts and blood smears. EDTA prevents clotting without causing major distortion of white blood cell appearance when smears are prepared promptly. Citrate, fluoride, and heparin tubes are not preferred for routine differential morphology. Question 73. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A, 70 to 99 mg/dl. Option B, 140 to 180 mg/dl. Option C, 200 to 250 mg/dl. Option D, 300 to 350 mg/dl. The correct answer is option A, 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 74. Which of the following situations can cause a false elevation in a patient's serum ammonia level? Option A, transporting the specimen to the laboratory on ice. Option B, delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Option C, using a green top tube containing sodium heparin. Option D, labeling the specimen tube at the patient's bedside. The correct answer is option B, delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Ammonia can rise falsely when cells remain in contact with plasma at room temperature. Prompt chilling, rapid transport, and timely separation help preserve the true value. Delays beyond recommended handling times are a major pre-analytical source of error. Question 75. Which of the following conditions can cause a specimen to be rejected due to hemolysis? Option A, using a needle with a large lumen, such as an 18-gauge needle. Option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Option C, inverting a serum separator tube gently 5 times after collection. Option D, centrifuging a completely clotted serum tube for 10 minutes. The correct answer is option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Drawing through a hematoma or pulling a syringe plunger too forcefully can rupture red blood cells. Hemolysis releases intracellular contents and may lead to specimen rejection or false chemistry results. Gentle inversion and proper clotting before centrifugation help protect specimen integrity. Question 76. What type of vessel carries oxygenated blood away from the heart to the systemic tissues? Option A, artery. Option B, vein. Option C, capillary. Option D, venule. The correct answer is option A, artery. Systemic arteries carry oxygenated blood away from the heart to body tissues. They operate under higher pressure and have thicker walls than veins. The pulmonary artery is an exception because it carries deoxygenated blood to the lungs. Question 77. Which of the following tests is typically ordered to detect systemic blood infections or septicemia? Option A, complete blood count. CBC. Option B, blood cultures. Option C, erythrocyte sedimentation rate, ESR. Option D, C-reactive protein, CRP. The correct answer is option B, blood cultures. Blood cultures are ordered to detect microorganisms circulating in the bloodstream. They are essential when septicemia or bloodstream infection is suspected. CBC, ESR, and CRP can support infection assessment but do not identify organisms in blood. Question 78. Which of the following tests requires a fasting specimen to ensure diagnostic accuracy? Option A, complete blood count, CBC. Option B, lipid panel and fasting blood sugar. Option C, blood culture series. Option D, prothrombin time, patient. The correct answer is option B, lipid panel and fasting blood sugar. Lipid panels and fasting blood sugar tests are strongly affected by recent food intake. Fasting helps standardize triglyceride and glucose measurements for diagnostic interpretation. CBC, blood cultures, and patient usually do not require fasting for accuracy. Question 79. When collecting a blood alcohol level for legal purposes, what antiseptic should be used to cleanse the site? Option A, 70% isopropyl alcohol. Option B, tincture of iodine. Option C, chlorhexidine gluconate or soap and water. Option D, hydrogen peroxide. The correct answer is option C, chlorhexidine gluconate or soap and water. Alcohol-based skin cleansers are avoided for legal blood alcohol collections because they can raise questions about contamination. Chlorhexidine, povidone iodine, or soap and water are acceptable non-alcohol alternatives depending on policy. Routine alcohol prep pads are appropriate for many venipunctures but not for forensic alcohol testing. Question 80. Chain of custody protocols are required for which type of laboratory specimens? Option A, routine lipid panels. Option B, therapeutic drug monitoring. Option C, paternity and forensic drug testing. Option D, blood cultures for sepsis. The correct answer is option C, paternity and forensic drug testing. Chain of custody is required when the specimen may be used as legal evidence or to establish identity. Forensic drug testing and paternity testing require documentation of collection, handling, transfer, and receipt. Routine clinical tests do not usually require that level of legal tracking. Question 81. Which of the following items is the preferred antiseptic for cleaning a site prior to performing an arterial blood gas, ABG, draw? Option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Option B, plain sterile water. Option C, diluted hydrogen peroxide solution. Option D, sodium hypochlorite spray. The correct answer is option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Arterial puncture sites require strong antisepsis because the procedure is deeper and carries higher complication risk than routine venipuncture. Alcohol followed by chlorhexidine or povidone iodine is commonly used according to policy. Sterile water, peroxide, or bleach sprays are not appropriate skin antiseptics for ABG collection. Question 82. Which of the following parameters is most heavily impacted if a phlebotomist squeezes or milks a finger during a capillary puncture? Option A, the sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Option B, the blood flow will stop completely due to arterial vasoconstriction. Option C, the platelet count will become falsely elevated beyond high limits. Option D, the glucose values will drop to zero within seconds. The correct answer is option A, the sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Milking a finger forces tissue fluid into the drop and can rupture cells. This dilutes the specimen and may cause hemolysis or inaccurate results. Gentle warming and proper puncture technique are preferred ways to improve blood flow. Question 83. Which of the following statements is true regarding a multisample needle gauge? Option A 21 gauge needle has a larger opening than a 22 gauge needle. Option B, an 18 gauge needle is smaller than a 23 gauge needle. Option C, the larger the gauge number, the larger the needle lumen. Option D. All needles used in phlebotomy have the same internal diameter. The correct answer is option A. A 21-gauge needle has a larger opening than a 22-gauge needle. Needle gauge numbers work inversely. The higher the number, the smaller the lumen. A 21-gauge needle therefore has a larger opening than a 22-gauge needle. Assuming all phlebotomy needles are the same size can lead to poor device selection and hemolysis risk. Question 84. What type of consent is demonstrated when an adult outpatient rolls up their sleeve and extends their arm toward the phlebotomist after being asked for a blood draw? Option A. Expressed consent. Option B. Informed consent. Option C. Implied consent. Option D. Statutory consent. The correct answer is option C. Implied consent. Rolling up a sleeve and extending the arm after being asked to provide a specimen demonstrates implied consent. The patient's actions show cooperation with a routine procedure. Signed informed consent is a more formal process used when required by policy or procedure risk. Question 85. Which of the following scenarios is considered a breach of the Health Insurance Portability and Accountability Act? HIPAA. Option A. Discussing a patient's laboratory results with the ordering physician. Option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Option C. Entering patient information into an encrypted laboratory information system. Option D. Sharing critical panic values with the nurse assigned to the patient. The correct answer is option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Discussing patient results in a public cafeteria exposes protected health information to unauthorized listeners. HIPAA permits sharing information for treatment with authorized team members, but only in appropriate settings. Casual conversations in public areas violate confidentiality even when the colleague works in healthcare. Question 86. Why is it essential to allow the 70% isopropyl alcohol to dry completely on the skin before puncturing? Option A. To prevent the alcohol from evaporating too fast. Option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Option C. To ensure the vein does not roll during insertion. Option D. To maximize the chemical interaction with the tube additive. The correct answer is option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Alcohol must dry completely so it can disinfect effectively and avoid being carried into the puncture site. Wet alcohol can sting and may contribute to hemolysis or specimen contamination. Blowing on or fanning the site can recontaminate the area and should be avoided. Question 87. If a phlebotomist notices that a patient's name on an ID band matches the requisition, but the medical record numbers are different, what should they do? Option A. Draw the specimen and cross out the number on the tube label. Option B. Proceed with the draw as long as the alphabetical spelling of the name is correct. Option C. Do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Option D. Ask the patient which number is the correct one to use. The correct answer is option C. Do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Matching names are not enough when medical record numbers conflict. The specimen must not be collected until the discrepancy is resolved by appropriate staff. Asking the patient to choose a number or editing labels manually can create a serious identification error. Question 88. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A. Routine cholesterol screen. Option B. Workplace drug testing. Option C. Blood culture for endocarditis. Option D. Complete blood count for anemia. The correct answer is option B. Workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 89. What should a phlebotomist do if a patient states they have a history of severe syncope during blood draws? Option A. Perform the venipuncture while the patient is standing up to keep them alert. Option B. Place the patient in a recumbent, supine, position on a bed or reclining chair before starting the draw. Option C, tell the patient to close their eyes and hold their breath during the puncture. Option D, request a doctor to administer general anesthesia before the draw. The correct answer is option B. Place the patient in a recumbent, supine, position on a bed or reclining chair before starting the draw. A patient with a history of severe syncope should be positioned supine or reclined before collection. This reduces fall risk and supports circulation if fainting occurs. Standing or breath holding increases danger and should be avoided. Question 90. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option of light blue top. Option B, lavender top. Option C, grey top. Option D, green top. The correct answer is option C, grey top. Grey tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing grey tubes too early increases additive carryover risk. Question 91. Which of the following additives is found in a yellow top tube used for human leukocyte antigen, HLA, typing or DNA studies? Option A, sodium polyent whole sulfonate, SPS. Option B, acid citrate dextrose, ACD. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is option B, acid citrate dextrose, ACD. Yellow ACD tubes contain acid citrate dextrose and are used for HLA typing, DNA studies, and some cellular testing. ACD preserves cells by anticoagulating the specimen while supporting cell viability. SPS yellow tubes are intended for blood cultures and have a different additive. Question 92. Which of the following practices is an example of an engineering control to prevent blood-borne pathogen exposure? Option A, wearing a face shield when opening specimen tubes. Option B, utilizing a sharps container with a wide, drop-in opening and safety needle shields. Option C, washing hands with antimicrobial soap for 20 seconds. Option D, following a strict order of draw sequence. The correct answer is option B, utilizing a sharps container with a wide, drop-in opening and safety needle shields. Sharps containers with safe openings and safety needle shields are engineering controls because they isolate or remove the hazard by design. These devices reduce needle stick risk during and after collection. Gloves and training are important but do not physically engineer the hazard away. Question 93. What is the clinical term for small, red, pinpoint spots that appear on a patient's skin when a tourniquet is applied? Option A, hematoma. Option B, hemolysis. Option C, petechiae. Option D, ichthyosis. The correct answer is option C, petechiae. Petechiae are tiny red or purple pinpoint spots caused by small capillary hemorrhages. They may appear when a tourniquet is applied to a patient with fragile capillaries or platelet problems. A hematoma is a larger collection of blood, while ichthyosis refers to broader bruising. Question 94. Which of the following tubes is typically selected for a zinc, copper, or trace element determination? Option of royal blue top tube. Option B, lavender top tube. Option C, light blue top tube. Option D, grey top tube. The correct answer is option A, royal blue top tube. Royal blue top tubes are designed for trace element testing such as zinc and copper. They minimize contamination from tube components that could falsely elevate trace metal results. Routine additive tubes are not manufactured to the same low contamination standards. Question 95. What type of vessel contains thick, muscular walls and carries blood away from the heart under high pressure? Option A, vein. Option B, artery. Option C, capillary. Option D, venule. The correct answer is option B, artery. Arteries have thick, muscular, elastic walls that carry blood away from the heart under pressure. This structure allows them to tolerate pulsatile pressure generated by ventricular contraction. Veins return blood at lower pressure and often contain valves. Question 96. What is the primary function of the anticoagulant EDTA? Option A. It enhances the action of thrombin. Option B. It binds calcium ions, preventing the clotting cascade from activating. Option C. It destroys white blood cells to preserve red cells. Option D. It stabilizes glucose levels by stopping cellular glycolysis. The correct answer is option B. It binds calcium ions, preventing the clotting cascade from activating. EDTA binds calcium ions and prevents the coagulation cascade from progressing. This preserves whole blood for hematology testing and maintains cell morphology. It does not preserve glucose or accelerate clotting. Question 97. What color top tube is used to collect specimens for blood bank immunohematology testing like antibody screens? Option A. Pink top or glass red top. Option B. Gray top. Option C. Light blue top. Option D. Light green top. The correct answer is option A. Pink top or glass red top. Pink EDTA tubes or glass red tubes are commonly used for blood bank immunohematology testing such as antibody screens. These specimens support red cell typing and compatibility testing. Gray, light blue, and light green tubes serve glucose, coagulation, and chemistry testing needs. Question 98. What is the primary function of the circulatory system's capillaries? Option A. Transporting blood under high pressure away from the ventricles. Option B. Permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Option C. Directing large units of blood directly into the vena cava pathways. Option D. Preventing the backflow of lymph fluid into the deep tissues. The correct answer is option B. Permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Capillaries are the exchange vessels of the circulatory system. Their thin walls permit transfer of oxygen, carbon dioxide, nutrients, and waste products between blood and tissues. Arteries and veins mainly transport blood to and from capillary beds. Question 99. Which of the following parameters is evaluated when checking a patient's prothrombin time? Patient. Option A. The functional capacity of platelets to adhere to vessel linings. Option B. The extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Option C. The total count of circulating red blood cells per microliter. Option D. The efficiency of the kidney to filter out waste urea molecules. The correct answer is option B. The extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Patient evaluates the extrinsic and common coagulation pathways and is commonly reported with INR. It is especially useful for monitoring warfarin therapy. Platelet function, red cell counts, and kidney filtration are assessed with different tests. Question 100. What clinical term describes the liquid portion of a blood specimen that has been allowed to clot completely before centrifugation? Option A. Plasma. Option B. Serum. Option C. Whole blood. Option D. Buffy coat. The correct answer is option B. Serum. Serum is the liquid portion of blood after the sample has clotted completely and been centrifuged. It lacks fibrinogen because fibrin clot formation has already occurred. Plasma is obtained from anticoagulated blood.